The effects of concussions are now being proven to be more traumatic than previously expected. Retired NFL players are experiencing some of the long-term effects due to a lack of reporting concussive symptoms. Making the symptoms of concussions more widely known will allow people to be better equipped to report them and to get the treatment necessary to reduce long-term effects. According to medical professionals, a concussion is a mild form of traumatic brain injury caused by a bump, blow, or jolt to the head. It is considered mild because it is not life-threatening. However, it can cause lasting damage on one's brain, predominantly at the sites of primary and secondary impact. The brain can be damaged in three ways. The cerebral cortex is directly contused when the head and a hard object collide. Entire nerve cells can be indirectly damaged when the brain is rotated due to whiplash, and the axonal fibers of the deep white matter can be stretched so much that they are severed. Post-concussion syndrome is the collection of noticeable characteristics following a concussion. It is marked by blurred vision, dizziness, disorientation, nausea, vomiting, headache, forgetfulness, irritability, depression, mood swings, insomnia, and loss of libido. After being concussed, it is common for some bleeding and/or swelling of the brain to occur. This is followed by frequent headaches, abnormal sleep patterns, sensitivity to sound and light, trouble with balance, loss of memory, and difficulty thinking clearly. These effects are dependent on the severity of the injury, but should all be taken seriously. In a 2010 study by Dr. Jamie Mansell, 201 college male and female soccer and football athletes were interviewed and asked whether or not they had ever been diagnosed with a concussion and how often they felt common symptoms of concussions following head impact in games or practices. Dr. Mansell found that 59% of athletes who were not diagnosed with a concussion had experienced the symptoms of a concussion after a head impact during his or her sport, compared to 80% of athletes previously diagnosed with concussions. This indicates that many concussions had occurred but were not reported or treated. Football players are, not surprisingly, susceptible to concussions due to head-on tackling. Concussions account for about 5.3% of all football-related injuries, according to the Mansell study. There is also evidence of a direct correlation among head and neck length and one's susceptibility to a concussion. It is possible to ease the cognitive, physical, and emotional symptoms after having a concussion. However, the healing process is dependent on the severity of the injury and on the age of the victim. Physical therapists advise getting plenty of rest, avoiding intensive physical activity, and, as always, avoiding drugs and alcohol. Concussions often leave lasting effects on the brain. Electroencephalogram readings reveal abnormal brainwave activity for years after the concussion, as well as attention and memory deficits and even symptoms of early-stage Parkinson's disease. After a brain is concussed, it is never 100% recovered.